Well, switching to some Utah news as we move closer to home and closer to winter, doctors and public health officials say flu cases are starting to rise right on schedule. Our Southern Utah correspondent, Cannon Sechrest, breaks down what we're seeing and what you can do to stay healthy.
The Southwest Utah Public Health Department says the most common strain of flu right now is type A. And while the season is tracking normally, prevention still matters.
One of the best gifts you can give to your loved ones is not to get them sick.
While many plan to travel during the holidays, health officials say that isn't the best decision if you're feeling sick.
If you're sick, especially with symptoms like fever and body aches to where it feels like, I'm really feeling down, our best advice is to stay home and wait till that recovers.
For parents, especially those around children all day like Abigail Clark, avoiding germs can feel nearly impossible.
Just being around kids constantly and having a 3-year-old in preschool, it's inevitable. Not everyone has the same hygiene standards, so no matter what you do, sometimes you may end up getting sick.
But she says their family does what they can.
We're also washing our hands a lot. Lots of baths, lots of hand washing, lots of nose blowing, hand sanitizer, just a whole regimen, really.
While flu cases are expected this time of year, public health officials are more concerned about the active measles outbreak impacting Southwest Utah.
We're now up to 82 cases as of yesterday in southwestern Utah. We are part of a larger outbreak that includes northern Arizona. I think they've got over 150 cases. And so right now, we're actually the largest measles outbreak actively in the United States.
The state says measles is extremely contagious, spreading through the air and lingering even after an infected person leaves a room. Public health officials say the vast majority of cases involve people who are not immunized.
Kids, small children, infants, especially if they have immunity issues, are at higher risk of having complications. And we've had some hospitalizations in our district and a couple of serious illnesses from this.
Health officials say the MMR vaccine, which protects against measles, is about 97% effective after 2 doses and provides long-term protection for most people. So if you think you may have measles, public health officials say do not show up to a clinic or a hospital unannounced. Call ahead first so that staff can take the proper precautions and help prevent further spread. Reporting in Southern Utah, Cannon Sechrest, ABC4 News.